There's a lot of confusion today in 2007 as to how advanced stem cell therapy has progressed in terms of using stem cells for treatment of patients. Here we're going to review a study that was published 3 years ago in one of the highest ranked medical journals, Lancet, demonstrating safety of stem cells and ability to help the heart after a heart attack. The background of the study is that after a heart attack or acute myocardial infarction, there is a lot of scar tissue that forms, and this scar tissue, even if you successfully revascularize and you have new blood flowing into the myocardium, there's a pathological sequence of deterioration characterized by decreased ability of the heart to pump, called an inhibited left ventricular ejection fraction. The chambers of the heart, particularly the left side of the heart, become dilated, and a progression to heart failure occurs. Now, there have been previous studies showing that stem cells can inhibit the pathological progression from revascularized heart attack to heart failure. These studies gave a small signal, if you will, but they didn't demonstrate conclusively. So the question of the current study is, can autologous bone marrow cells ameliorate the post-infarct cardiac deterioration in a double-blinded, in a randomized controlled study? So the inclusion criteria of the study was that patients had to have had the onset of the heart attack 5 days before entering the study. They had to have been successfully revascularized with percutaneous intervention, and the stent had to have been placed in an infarct-related artery, and the heart has to have displayed some abnormal motion in 2/3 of the left ventricle. Abnormal motion being hypokinesis or complete non-motion akinesis. Exclusion: the patients were not supposed to have multivessel heart disease, pulmonary edema, cardiogenic shock, organ dysfunction, or cancer. The intervention, the way the patients were treated, was approximately 2 billion nucleated bone marrow cells from the iliac crest were collected, and they were infused in the infarct-related artery using a balloon. And the balloon was an over-the-wire balloon catheter. So the balloon is placed by a catheter into the infarct-related artery, and then it's inflated. When it's inflated for 2.5 to 4 minutes. During the inflation of the balloon in the artery is when bone marrow cells are poured in. This is called temporary occlusion. The purpose of the inflation is so that the cells will stick there. And between the occlusions, between infusing cells, there's a gap of 3 minutes. So this was the intervention. Initially, 78 patients were identified as being eligible. Of these, 65 were randomized to either a control group, 32, or 33 into the treatment group, which received the bone marrow transplant. Of these ones, 2 patients were not eligible because of MRI at the baseline, which gave us 30 patients had to be control, and also 3 patients of the treatment group were not eligible according to the MRI, so 30 was chosen for the treated group. So in the end, 30 patients were selected and placed on optimal medical care, but they did not receive the cell therapy, and that was the control group. The other 30 patients were in optimal medical care, but they did receive the cell therapy. And if you look at the patient characteristics, this is a sample of the patients between the control and the bone marrow treated. Most of the characteristics were all the characteristics were non-statistically significantly different. This is to show that there was no biasing of the patients. At the 6-month interval, when you look at the left ventricular ejection end diastolic volume or end systolic volume, global ejection fraction, and other parameters, you will see that at 6 months there was a statistically significant increase in the left ventricular ejection fraction in the group that received the bone marrow cells, the autologous bone marrow cells. And when you look at the figure in a figure format, you will see also the statistically significant increase in left ventricular ejection fraction at 6 months in the group that received bone marrow, but not in the group that did not receive anything. When looking at the wall motion score, on the top panel are the control patients. The black indicates non motion or poor motion, whereas the yellowish indicates proper motion. As you can see in the top panel, baseline and then 6 months. At 6 months, there seems to be an increase in the area of blackness, demonstrating that there is increased akinesis or the level of motion is deteriorating. On the bottom panel, the bone marrow cell group, you can see that compared to baseline, there is actually a decrease in the black area or a decrease in the area of poor motion, indicating that not only did we have a better left ventricular ejection, but also showing better motion, better cardiac wall motion. More importantly, is this procedure safe? No patients died or were lost to follow-up who entered the study out of the 30 that were treated. There was no increases in troponin T in the serum even after the patients received the transfer of the bone marrow. This indicates that it's safe to inflate the balloon and inject bone marrow cells into the infarct-related artery. And at 6 months follow-up, 3 controls and 1 patient from the bone marrow cell group, they needed to enter the hospital for worsening heart failure, and they were treated with optimal therapy, then they were released. And also, very importantly, there was no difference in ventricular complexes, there was no arrhythmias or sustained ventricular tachycardias as determined by the Holter monitoring. So the procedure seems to be safe, and it seems, in conclusion, it seems to have efficacy in terms of increasing left ventricular ejection fraction and increasing a global wall motion score, and the safety of the procedure was confirmed by the study. Next steps in the future, of course, will involve combining this stem cell modality with other modalities to increase efficacy, but for now we believe that this is some pretty strong data that stem cell therapy can be used for treatment of post-infarct heart failure, and now there are many other studies besides this one which are doing this. Thank you very much.